Hi, my name is Dr. Bethany Rife. I'm a pediatrician. I've been practicing since 2012. For the past 7 years, I was part of a regular insurance-based practice. Just this past January, I left that practice and started my own practice where I just take cash, and it's called Direct Primary Care. And I work on a membership base so that I'm fully available to my patients. They can text and call me, and I can take better care of my patients and do better medicine this way. So as a pediatrician, I was trained that vaccines are safe and effective. I also believe that parents should fully be informed and have their choice. So my practice consists of several vaccinated, unvaccinated, and partially vaccinated children. With each child and family, I discuss the pros and cons, the issues related to vaccines. A lot of new issues have come up, and we discuss those. I'm continuing to research the new issues that parents have questions about, some of which, to be honest, I haven't heard of before. Just like I haven't heard of different side effects of every other medication that's out there. And so when a parent has a concern or a question about a specific side effect or a question about a vaccine, I have to research that just like I would have to with any other medication or medical intervention. So that's where I am. I'm continuing to research these things and try to answer parents' questions to the best of my ability. I want parents to make an educated choice, and I do believe that it may be individual for some parents. For one family, it might be best to hold off for a short time or to fully vaccinate. It really fully depends on what that mom is comfortable with, and I believe that she gets that choice. But within that, every parent should fully understand what these diseases are, what they were in the past, and how and what the dangers are of these diseases, what the risk of that disease is now, and how that could affect their child, and what the likelihood of that is. As well as with the vaccines, what is the likelihood of some type of vaccine reaction? How dangerous is that reaction? What are the long-term effects of that reaction? That's what I really believe parents should understand and should know, and that's how they, on their individual basis, on how comfortable they are either way, whether they should, how they should make that decision for their own child. And it may differ per child in the same family. But I do fully believe that parents should have that choice. And I also believe that vaccine reactions are very rare. I have been continuing to research the discussion about vaccines as far as the different things in the vaccines. I'm still in the process of trying to find legitimate research and good information on on these different concerns that people have about vaccines. Of course, my main source is the FDA and the CDC, and of course the argument is that we can't trust the FDA or the CDC. So the only way for me to have this discussion is to try to find data or research that's not from them. Well, that's difficult to find. So within that, I'm available to answer questions. I'm fully willing to have this discussion, and the main thing I want people to realize in having this discussion and being open to this is that as physicians, as pediatricians, we want what's best for your child. I think that all children deserve medical care, no matter if they're vaccinated or unvaccinated. I think that we as pediatricians should see all of these children and should accept them into our practice. I understand that there's a lot of discussion and debate about that, but they're children and they deserve care. And we should find ways of doing that, no matter what practices are comfortable with. And physicians need to figure out a way to make that work. Because as I found, what really matters is that these parents learn to trust the physician. And whether they trust the CDC or the FDA or not is irrelevant if they trust the physician. And that's the key. And we, in turn, need to be compassionate and understanding with these parents, with all parents, about any disease and any question and any medication or any intervention. This should be a back and forth discussion. What is best for this child in this particular situation? And let's come to an agreement on that and continue to walk that parent through that. Even if the physician disagrees, the parent gets to make that choice, assuming we're not harming the child in any way, of course, but that's the parent's choice. So that's to say, I don't consider myself pro-vaccine or anti-vaccine. I am pro-children's health and parental guidance in that, and parental choice about their child's health in any medical intervention. I don't think that physicians should convince or coerce parents into anything, but as physicians, we do have an education that the parent does not have, and so we can use that as far as discussing that with the parent and trying to explain, and we can explain. We can explain exactly what we know and what we understand, and then the parent still gets a choice. And that's what I want people to understand, that this is the physician's role. This is what I do believe most physicians and pediatricians want to do. And our main concern is making these children healthy and making all children healthy. So I'm aware that this discussion is something that most pediatricians are very unwilling to have, and that's why I think it's very important to do, so that parents can feel confident in their decision whether they're vaccinating or not, so that they can have the information and they can make that educated choice. And I fully believe that that is the role of a pediatrician and a physician, and so that's why I'm having this discussion today.